I found using the Out of Fog program as a new counsellor at the time that the training and the resources and the support incredibly helpful and confidence building, to the point where I felt like I had the tools and I was well equipped to implement this program independently. I also found that it was incredibly rewarding to see the positive impact that this program had on the clients. What I liked about using the Out of the Fog program is that it was evidence-based and it is also holistic. I also liked the fact that I could have a comparison of symptoms before the program, during and after. So this data collection for me was really helpful, knowing that it was useful and making a change. What I also liked about the program is that it worked on different levels, and throughout the process there was a process of education and learning about different interventions and equipping the clients with knowledge and tools to make changes. And it wasn't just me sharing information, they were also taking things on board and making changes in their own lives and doing the homework and the online learning that went along with that. Being able to work alongside other healthcare professionals and GPs and crisis teams as needed was helpful for me. I liked that about the program. I didn't feel like I was on my own. There were other community services out there I could link in with as needed. The differences that I saw in my clients was that there was a shift in their perception. So even though the struggles in their lives might still be there at the end of the program, there might be a small shift in the way they viewed the world, and that kind of allowed them to make small changes that would ultimately be quite significant in changing their moods. Why would I recommend Out of the Fog over something else? Well, I think as a counsellor, as a social worker, you're incredibly well equipped and well resourced and well supported to implement the program. I also think it runs really nicely alongside other services that are out there, other healthcare professionals and what they provide, GPs, psychiatrists. This runs quite independently, but not, it doesn't contradict anything. It can work alongside those services. And it also works in so many different levels. So we know that with depression it's often not just one thing that fixes it. It often works alongside sometimes medication and counselling. So this is another way of equipping the client with tools. I think something else that was quite evident in this program was that when there were groups involved in the program, that the connections between the clients was very powerful, and the sharing and the openness and breaking down those walls around shame and just allowing an openness and making it safe for clients to share what they were going through had a very positive impact on their wellness as well.